If you're dealing with low libido after menopause, you may have heard of testosterone therapy. Let's break it down with evidence-based medicine. Hi, friends, and welcome to another episode of A to Z of Menopause. And today we're talking about testosterone therapy. We're on T. So the biggest question is, do women even produce testosterone? The answer is yes. Some of it is produced in your ovaries, some in your adrenal glands, and some through your skin. And it's mainly important for regulating your libido. And that includes you feeling aroused and you achieving satisfaction. So do you need testosterone therapy in perimenopause and menopause? Well, in terms of evidence, there isn't much evidence for any indication during perimenopause or menopause. But hear me out. It is suggested that we can use it off license in cases of hypoactive sexual desire disorder, which is basically libido issues after we've ruled out everything. So you're not having libido issues because you don't like your partner anymore. And it's not because sex is painful because your vaginal tissues are friable and dry. And it's not because of any mental health things. You just don't feel like having sex. You just don't feel aroused anymore. So sometimes we can use testosterone therapy in those cases. So the studies do show that it can increase sexual satisfaction on an average of 1 time a month. It may improve desire, it may decrease sexual distress, and it works for women who have gone through natural menopause, but also surgical menopause, which we talked about yesterday. 3 things that are important to note are: number one, it does not help with symptoms of hot flashes, low energy, low mood, or bone health. Number two, it's supposed to be a short-term treatment only. And number three, it is off license. So it is not licensed for this specific use. I use it in my practice if my patients have a diagnosis of HSDD, but I'm very strict with my patients. And that means I am very on top of my game with monitoring their testosterone levels to make sure it doesn't rise above a certain number. And we have an agreement that if they haven't noticed any difference within 6 months, then we come off of it. Because if you haven't noticed a difference at that point, you're unlikely to notice any difference whatsoever. There's evidence to show that if you do get side effects from testosterone therapy, which may include like male pattern hair growth, voice deepening, acne, then these effects might be permanent even if you do stop testosterone therapy when you get them. And my patients don't want that, and I don't want that for them. So we have to be very careful when initiating and maintaining testosterone therapy. So bottom line and key takeaway from this is, if your libido is affecting your quality of life, then speak to your doctor about your options, including testosterone therapy, but know that it is off license and it is not recommended for everyone, and it requires very strict monitoring. Please let me know if this was helpful and leave me a comment in the comment section below, and I'll see you tomorrow for you.